there was an idea that the heart was the repository of emotions. And that was a very ancient idea. But in modern science, we're starting to see that emotions can have a profound effect directly on the heart. Probably the most significant observation that I can think of is what's called the broken heart syndrome, in which people who undergo tremendous emotional upset, like after the breakup of a romantic relationship or the death of a family member, can suffer congestive heart failure. They can have direct damage to the heart, in which the heart can actually change shape. And so I think we're starting to understand more and more that the heart may be a pump, but it's also a highly emotional pump.
Welcome to Empowered Kids TV, where we introduce you to the people and ideas to help you take action and create the family of your dreams. Today, our guest is Dr. Sandeep Jauhar, who is a cardiologist, best-selling author, speaker, and the director of the Heart Failure Program at Long Island Jewish Medical Center. Dr. Sandeep has been writing about medicine and health for the New York Times for over a decade. He took his healthy obsession about unhealthy hearts to find out what really impacts the health of our hearts, and more importantly, what things can we do to ensure we maintain our heart's health. While heart disease is a leading cause of death globally, few within the medical community talk about it with as much passion and holistic understanding. I am excited for today's conversation with Dr. Sandeep because he shares the link between the metaphorical heart and our physical heart in a way that excites and intrigues me. It is my pleasure to introduce you all to a man who followed his passion and his family history to help us all understand our hearts better. Sandeep, welcome to Empowered Kids TV. So you said that a record of our emotions is written on our hearts. And I want to talk a bit more about what you mean by that.
Sure. Well, as you know, from reading the book and just being part of this world and this culture, the heart was always thought of as the place where emotions reside. And this is a concept from antiquity, where, Greeks and Egyptians, ancient Egyptians would observe, how the heart would speed up in times of emotional upset. And that idea of the heart being the repository of our emotions really persisted through the Middle Ages, and even up to the point in the mid early 17th century when William Harvey and others figured out that the heart was in fact a pump, a pump that pumped blood and circulated blood. But what's really fascinating about at least my idea of the heart and an idea that's starting to gain more credence in modern medicine is that the ancients were onto something. That in fact the heart does respond to emotions. There was an idea that the heart was the repository of emotions, and that was a very ancient idea. But in modern science, we're starting to see that emotions can have a profound effect directly on the heart. Probably the most significant observation that I can think of is what's called the broken heart syndrome, in which people who undergo tremendous emotional upset, like after the breakup of a romantic relationship or the death of a family member, um, can suffer congestive heart failure. They can have direct damage to the heart, in which the heart can actually change shape. And so I think we're starting to understand more and more that the heart may be a pump, but it's also a highly emotional pump. And I think that we will need to understand that better, to make further progress in how we treat heart disease.
So you talked about broken heart syndrome actually changing the shape of the heart. Is that also the same for things like stress and fear?
Yes. So the broken heart syndrome is also called Takotsubo cardiomyopathy, and it's a syndrome in which the heart actually changes shape, and it changes typically into the shape of a special Japanese pot called a Takotsubo. And there are speculations as to why that happens, but we know that it does happen. Um, I think what you're asking is what kinds of emotions can acutely change the heart. What you just mentioned, fear, anger, anything resulting in tremendous emotional upset, has been linked to Takotsubo cardiomyopathy. So it's not just the breakup of a romantic relationship, but sometimes like a surprise birthday party,
Mm.
or uh, an episode of public speaking, or um, you know, uh, the incurring of gambling losses. Anything that's very upsetting can affect the heart. But you know, the 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 flip of your question is, can low level fear or stress also cause heart damage? Like, we know that acute disruption can really mess up the heart and cause this broken heart syndrome. But what about chronic low level stress? So that
Mm.
also has been shown to have profound effects on heart disease. The Whitehall studies, which were done in England, um, showed that in the British civil service, people who were at the bottom of the social hierarchy had much more stress and had much higher mortality rates and heart disease rates than those who were at the top level of the hierarchy. So, occupational stress, low level occupational stress, can also profoundly affect the heart, um, causing coronary artery disease, for example. And we also know that ways in which we can alleviate stress, through exercise, meditation, whatever, can also have
Mm.
significant benefits for the heart. So I think that stress, uh, and emotions, um, we're learning now, are uh, have profound effects on the heart, and they need to be part of how we conceptualize heart disease.
I want to also kind of push the conversation to beliefs. So there are a few stories in your book that I found really intriguing. So one was, how does the belief that something external is going to hurt me, something that I feel I have no control over? And I was wondering if you can share a little bit about some of the stories that you do have in the book and the impact of having a belief of danger on the heart.
Yeah, yeah. I mean, so so there's been, a long, anthropological history of voodoo death, in which, people feel that they've been cursed, like by a witch doctor, and they very rapidly die. And for the longest time, we didn't know why. It's probably related in some sense to Takotsubo cardiomyopathy.
Mm.
And Walter Cannon, a Harvard physiologist, speculated, like, decades and decades ago about how voodoo death could happen, and he thought that it was probably a massive drop in blood volume because of how the heart was affected, resulting in a decrease in oxygen transport to organs, and then basically shutting down the body. Whatever the physiological reason, we've seen this over and over again. Anthropologists have documented this. So there seems to be a profound effect on the heart when people feel that they're in situations over which they have no control, and it can result in both a highly sympathetic response, where your adrenergic nervous system gets revved up, adrenaline gets produced, and the heart can suffer damage and speed up. But interestingly, at least in animals and probably in humans too, you can also sometimes see a profound parasympathetic response, where the heart can actually slow down in response to hopelessness. And they've seen this in rats who are essentially waterboarded and in these horrible animal experiments. But they did see that in some cases people can get a profound parasympathetic response as well. And there have been a lot of sort of speculations, in the literature. Polyvagal theory is one that kind of looks at this, but apart from the theoretical underpinning, it's something that we see, that profound stress can affect the heart both by speeding it up and sometimes by slowing it down. But whatever the actual mechanism, it can result in serious heart damage, and sometimes in total hemodynamic collapse, where people can just die very quickly. And this is probably the reason why anthropologists, when they were studying Aboriginal groups and so on, would see this kind of voodoo witch doctor type of death.
So I grew up in the Caribbean. We didn't have voodoo death, but we had something called obia. And it's basically the same sort of folklore myth that somebody external to you can do something. And it was interesting for me to watch the differences in people's lifestyle, just simply based on how much they believed in the folklore versus not believing in the folklore. And I wanted to kind of push on beliefs a little bit to see if the way our beliefs interact with the physiological operation of our heart, if that's very similar to the way our beliefs will have an impact using a placebo. So is it the same dynamic that's happening?
I mean, I think the underpinning of that is that the mind is very powerful, and the mind affects the body. And it affects the heart, but we also know it affects the immune system, and it can affect itself. The mind, chronic stress can accelerate brain damage and dementia. So I think what this points out to is that the heart, notwithstanding, which I think is a very, very important organ, probably the most important organ for longevity, for maintaining health, is right up here. It's how we respond to circumstances, whether we have negative beliefs ingrained into us that we cannot really slough off. These can have profound effects.
Let's talk a little bit about the medical community. So obviously what you're saying to us is that the physical heart is not unlinked to the emotional heart, that really the emotional experience that we're having is minute by minute shaping who we are, including the structure of our heart. So do you think the medical community from like I would go to my doctor, do you think we've caught up where it's not just physical symptoms that get checked off a list, but that we're now in that scenario, doctor and patient exploring the emotional environment of a patient when looking at how do we help people regain heart health?
I think that the community is catching up, but I think there's a long way to go. So, when I was in training 20 years ago, the focus of heart medicine and training in heart medicine was on appreciating the nuances of the biomechanical pump. So we would talk about, the capacitance of the ventricles. We would talk about compliance curves. We would talk about the resistance of coronary arteries. We would talk about systemic vascular resistance. These are all sort of, physical, mechanical concepts that really helped us conceptualize how the heart was performing. But there was really no talk about the effect of the emotions and the mind on the heart. And in fact, even the American Heart Association still does not list emotional stress as a key modifiable risk factor for heart disease. Now, this is after numerous studies have shown that there is a link. And there's a very strong association, to the point where I think that it kind of strains credulity to think that the mind and emotions don't affect the heart. At this point, I think it's pretty clear that they do. But cardiologists, doctors in general, I think still don't really want to talk about that because it's very hard to reduce emotional stress. It's not like giving a pill for cholesterol, So how do you get into someone's life, and how do you advise them in ways to reduce stress? It's in the end it requires a very individualized approach, and doctors, even psychiatrists, psychologists don't really have the time in our current medical system to like delve into why. So people have to take this on themselves. And I think one of the reasons I wrote the book is that I want people to understand that emotional stress does affect the heart, and it affects the heart both acutely, like with Takotsubo cardiomyopathy, but also chronically by being a risk factor for heart and coronary disease. And increasing the awareness of that through this podcast and people reading the book and just talking about it will, raising awareness will I think get people introspecting about what it is in their lives that they can improve. Like, I found out 8 years ago that I have coronary artery disease. I went for a CAT scan because of some other problem, and they found coronary calcifications. And then I did a CT angiogram, and they found that there were like 30, 40, 50% blockages in my coronary arteries. I was 45 years old, and it was like getting hit by a ton of bricks. I had two small kids, and when I looked at my life, I realized that I had just been running on this treadmill for years and years, pushing myself, at work, outside of work, whatever, to get as much done as possible. And it wasn't really good for me. And I tried to make some changes in my lifestyle. I started exercising every day. My wife encouraged me to do yoga. I didn't find that relaxing at all. But but the point is that it requires an individualized approach. Some people will need to do meditation, yoga. Some people may find aerobic exercise the way to go. Some people may find just greater engagement in social activities. Focusing on relationship with their children. There are a lot of toxic relationships in our lives that can really affect us, and we don't realize it. And we kind of go about living. It's like those Whitehall civil servants. They go to their job every day, and they're seeing, they have no control, or little control in their lives, and they're sort of experiencing this low-level stress. And then, when they're like, late middle age or in early and old age, they die. And we need to be aware that that you know, how our minds are affecting our health, and start doing something about it early. So, before all the damage is done.
One of the things that gave me hope was the discussion around the fact that when you saw the changes to the heart with something like broken heart syndrome, you could also go back and test after that person had done work to sort of alleviate the stress and find the emotional balance, and recognize that the heart again changes to accommodate for the fact that it's feeling better. So I wanted to kind of talk a little bit about that, so that our parents don't walk away from this episode thinking I'm stressed, so this is doom and gloom, but that there is hope that we can do things to change the heart.
Yeah, absolutely. I mean, Takotsubo cardiomyopathy, you know, can result in death. It's rare, but it can. But but it can also result in congestive heart failure, life-threatening arrhythmias. All the things that we associate with heart failure can occur with Takotsubo cardiomyopathy. But in most cases, things get better. And I've seen it myself. I said in my TED talk and also in my book about a woman who came into the hospital. She Her husband had recently died, and a week after the funeral, she was looking at his picture, became tearful, and then she developed chest pain, shortness of breath, all the signs of congestive heart failure. Came to the hospital. We did an echocardiogram, which is an ultrasound of the heart, and we found that her heart had ballooned into this distinctive shape of a Japanese pot, a takasubo. And she was short of breath. Her blood pressure was low. I mean, she was in distress, physical and emotional distress. But she got better. When the emotional sort of upset subsided, and sometimes we have to help it along by giving anti-anxiety medication, antidepressants. Um, Sometimes it's just time that heals those emotional wounds. But typically, when those emotional wounds are healed, the heart goes back into a normal shape.
Mm.
So it's not a permanent change.
You talked a little bit
Yeah.
about your own experience with heart disease, and I thought this would be a good segue to share some of the things that we can use as a daily practice. And I know you're saying it's very individual, but things that we can probably look at to incorporate within our lifestyle, so that one, we can help heal our heart if we know we've been managing chronic stress, but also things that we can do to maintain our heart's health.
Yeah. So, I mean, I think I alluded to that earlier, but it requires a personalized approach. You know what I mean? Like for for some people, it's going to be, for parents, for example, especially parents of teenagers, it's going to be focusing on your relationship with your teenager, because that is very often incredibly stressful. Being the father of a teenager and a near teenager, I can tell you that they change, and in ways that you would never have expected. But you still love them as much as you ever did, and times it can be painful when they talk back and they don't listen and whatever. So um, so for a lot of people, at least in my sort of social circle, it the focus should be on improving relationships with your spouse, with your children, with your parents. These things can have profound effects. um, the question is, what are the ways you can reduce stress in your life? That is not a one size fits all kind of answer. So for some people, like for me, I find that physical exercise, basically just running
Mm.
daily, not for a long time, just even 15 minutes, is does wonders for my sort of mental well-being. And it allows me to function better in the hospital and deal with the stresses of the hospital. And now New York is starting to get a resurgence of COVID cases, and I'm in the hospital right now. And a few months ago, we were the epicenter, the global epicenter. It was an incredibly stressful time. So for me, exercise really helps. For my wife, as I mentioned, hot yoga seems to, be, but the couple times I did it, it was horrible. I hated it. I was much more stressed afterwards. So, I can't tell, I used to go on book talks. People would say, well, what can I do? Well, I can't tell you, but all I can do is try to raise awareness so you can figure out the answers for yourself. But the most important thing is that we be aware that that there is this thing called broken heart syndrome. There is a very clear association between chronic emotional stress and coronary artery disease and heart attacks. The more we realize that, I think the more we'll focus not just on reducing cholesterol and blood pressure and blood sugar, but also reducing, our emotional stress. And I think that, for most people, it's going to be a personal thing. But I think government can also play a role, because Takotsubo cardiomyopathy is not just a personal. It not just doesn't occur just because of personal upset. It can occur in response to a socially disruptive phenomenon like an earthquake or a hurricane. So clearly,
or a pandemic.
Or a pandemic, exactly. I just wrote a review about Takotsubo cardiomyopathy during the pandemic, and what we found is that people who were infected with the virus have many more cases of Takotsubo or cardiomyopathy in general. But what was interesting is that even people who were not infected by the virus, those numbers of those people who were not infected have also seen tremendous rises in Takotsubo cardiomyopathy, suggesting that widespread mental, stress is affecting our hearts. So, governments and leadership also plays a role. We need to, once we get out of this, we need to, find ways of connecting with each other, connecting with nature, connecting with families, connecting with friends. So there's a lot that we can do, but it's going to require leadership. But it all starts with awareness of the problem, and figuring out ways to attack it, because the first step in treatment is making a diagnosis.
And it makes so much sense to me when we kind of go back to some of the things we've talked about today. So we've talked about the impact of fear, obviously stress. There's lots of different types of stress: financial stress, people trying to juggle homeschooling and work and everything else. That's increased stress. But also for a lot of people, there's this fear that it's something external to them that they don't have the power to control. And there is that sense of hopelessness. So it's a lot of the things that we've talked about already today that can really impact the shape and the structure and just the health of your heart. So I think you're absolutely right that we need to be kind of thinking ahead of the game. What do we then do on the back of this to make sure we regain the balance in our lives individually, but collectively?
Yeah, absolutely.
Tell us where we can find out a bit more about your work.
Well, you can follow me on Twitter. My handle is @sjauhar, SJAUHAR. You can go to my website, sandeepjauhar.com. But my books are all on Amazon, and I would love to see more people in the UK and around the country read the book. It was a finalist for the Wellcome Book Prize, and it got a great reception in the UK, as well as in the US. It was a PBS NewsHour and New York Times book review book club pick of the month. So So it had a wide readership, and I was very pleased. So, but yeah, I would welcome people, follow me on Twitter, message me, I love to hear from people.
Beautiful. My last question for you, Sandeep. What does it mean to you to live an empowered life?
I mean, I think a lot of it is understanding what's important to me and disentangling what's important to me from what's important to other people. I think for most of my life, at least I would say early adulthood, I was striving to do things that weren't necessarily making me happy, but I thought that I sort of needed to do them to win praise or acceptance. And I think a lot of people go through that. It wasn't unique to me, but I think now as I get older I see you know the finiteness of it. It's important for me to do things more on my own terms and do what makes me happy. And I think once you establish those values, what's important to you, not necessarily to your parents or to somebody else, and you work with those set of goals and values in mind, to me that's true empowerment. That that's true autonomy, independence. So that's what I strive to do.
Beautiful. Sandeep, thank you so much for joining us today and for
Yes, you're
sharing how we
welcome.
can take better care of our hearts.
You're welcome. Thank you so much.
Thank you so much for joining us for this episode of Empowered Kids TV. I'd like you to do us two favors. If this is your first time here, be sure to subscribe and press the bell icon so we can notify you of upcoming episodes and you don't miss any of our amazing programs. And if you found value, please share it. It still takes a village. So share this with your family and friends. As we always say here at Empowered Kids TV, you're just one connection away. With love and gratitude, empower us. Until next time.